Okay, let's start. Others will be joining shortly. So, very good evening to one and all. I hope I'm audible. Hello. Very good evening to one and all. I welcome you all for today's workshop, which is the topic is Happy Mother, Healthy Baby Workshop. And the topic, as it suggests itself, when mother is happy, the child will be healthy. So, we want because the aim of a perinatal mental health vertical is the aim of a perinatal mental health vertical is to uh, make the journey of pregnancy happy for the mother and the family and the child. So we have started these series of these workshops. Today this is the first workshop, Happy Mother Healthy Baby workshop. Very good evening to all. I am Major Anupa Carey. I'm the director perinatal mental health vertical speaking to you. Perinatal mental health therapist trained from speaking tube itself, a psychologist, and a psychotherapist. So, before today, we'll be learning the basic techniques to minimize stress during pregnancy. These techniques can be used in day-to-day situation also, but we'll be focusing on a pregnant woman. So, let's start with our presentation. And before going with the techniques, I just want to show you some data to make you clear that why we need such workshops. What's the need of such workshops? Why should we should be focusing on the mental health of a lady when she is pregnant? So I'll just present some data to you. Yeah. So this is the data from United States, which says that 1 in 5 women suffers from mental health disorder like postpartum depression during pregnancy or 1 year following the birth of the baby. But out of these 1 in 5, only less than 15% will receive treatment. This may be due to various reasons. Main is lack of awareness, then lack of specialists, availability of specialists for providing proper treatment to the woman. Then 1 in 7 will experience depression during pregnancy. Up to 50% of women who are living in poverty will have uh, mental health disorder of some kind during their pregnancy or perinatal period. And not only women, 1 in 10 dads also suffer from some sort of mental health disorder during the period when their wife is pregnant or following the birth of the child. So, dads are also very important. Then another data of US shows that anxiety and depression have risen 37% in teen girls. Now, what's the significance of this? Because these teen girls will be uh, pregnant or later on in their life. So when they will be carried, there is more chances of these girls suffering from mental health disorders during pregnancy or in the postpartum period. So it's an alarming figure. More than 600,000 women suffer from mental health disorder, maternal mental health disorder in US every year. And not just moms, the mental health of the mother during pregnancy and perinatal period affects the whole family. So it's very important to take care of the mental health of mother during pregnancy. So this was about US. Now, data from UK. It shows that 20% of women develop mental health problem during pregnancy or 1 year after birth. Now, 40% of the women who have some sort of traumatic birth experience, they suffer from PTSD, post-traumatic stress disorder. And 1 in 10 women develop postnatal depression. This is the data from UK. This is also very alarming data, which says that suicide is the biggest cause of death of for women during pregnancy and first year after birth. So, this is also very important because pregnant woman is committing suicide because of depression and other issues. So, it's also that is the main reason we should be talking about the mental health of the lady who is pregnant. Now that was about the world. Now coming about Indian publications. So in February 24, 2023, NDTV Banega First India, they published the data. This is a global data. This is not an Indian data. They said that a woman dies of pregnancy-related cause every 2 minutes. And every 2 minutes, one woman is dying because of some pregnancy-related cause. And most of these are preventable, right? If right care is given at the right time. So we have to propagate. We have to make the crowd aware of the maternal health issues which a mother faces during pregnancy. And the same article they have published that there is an estimate 287,000 deaths, maternal deaths in 2020, and most of these deaths were in low and middle income countries. Now that was the global data. Coming to our Indian scenario. So in May 2024 this year, Indian Express has published an article in which they have shown the death number of maternal deaths from 2014 till May 2024 this year. You can see this 2014-15 it was 691. From in 2023 till May 24 it is 279. Though the rates are reducing, but why should a woman die of pregnancy related causes? Pregnancy is not a disease. It's a time to enjoy. It's a time to have a new life in the world. So no one should die of pregnancy related causes. Still 279. This is only till May. It's a good, very high number. Now, coming to the Indian scenario, if we see the breakup, antenatal mental health disorders account for 22% of the population. Post-traumatic stress disorder is 9%. Perinatal depression 14 to 24%. And suicide rates are 7.6% in perinatal period. Though it is also mentioned that this data may not be accurate because in India we are not able to collect data of remote areas. So this may not be properly very accurate data. Okay. Now this was about the maternal health. Why should we knowing about the mental health of the mother during pregnancy? Why should we worrying about it? Now coming to what impact it causes on the child or in the womb. See, a lady who is having poor mental health, she gets pregnant. So what will happen during pregnancy? Because of poor mental health, she will not go for a regular antenatal or postnatal checkups. She may not be able to take proper nutrition. So there will be increased risk of preterm birth and preeclampsia, that is hypertension, high blood pressure during pregnancy. Now this lady delivers. What will happen? She will not be able to breastfeed the child properly. There will be issues in bonding with the child. She will not be able to take care of the child properly. So what are the risks which the infant is facing? He will have risk of mortality, low birth weight. He may not be getting exclusive breastfeeding, and there will be disruption in the maternal infant bonding and attachment. This is very, very important. This is the time where the child learns to trust other persons. If the child from infancy is not able to trust his mother, he will have trust issues later in his life. So this point is very, very important. Now when the child grows up, as a children, what risk he faces? He may have be underweight or stunted growth. He may have poor cognitive development. And there will be more episodes of illness because there may be no proper immunization for the kid. And as the child goes into adolescent stage, there will be high rates of suicide because as the child reaches puberty, the risk of mental illnesses which he was carrying from the womb increases. These mental illnesses generally come out during adolescence, during puberty time. So there is a higher risk of the child developing mental health disorder if mother has poor mental health. So again, what happens if this child marries and then she becomes pregnant? She will have a poor mental health. Then this whole cycle will continue and continue. So that is why the mental health of mother is very, very important, so that the child is also born with a good mental health. Okay. Now one more slide I'll just show. After that we'll start with the techniques. See. A mother who is stressed during pregnancy. So what happens? During stress, our body produces lots of serotonin, which is known as stress hormone. So this serotonin leads to neuroinflammation, that is inflammation of the nervous system, the nerves in the brain. And this leads to cognitive deficits in the child, emotional deficits in the child. The child will not be able to connect properly when he grows up in the society. He will have emotional issues. There are so many mental health disorders which are because of the mother taking too much of stress or mother having some mental health disorder when she was pregnant. So, because of all these reasons, we are uh, conducting these workshops where we should know how a mother should relax, because see, stress is a part and parcel of our lives. You cannot say, मुझे तो बिल्कुल stress नहीं है, I'm free of stress. There is something keeps happening every day. Even you want to keep yourself stress free, it's not possible because something happens and you suddenly become stressed. So you should know few techniques, basic techniques which you can do yourself to relax yourself, especially when you know you are pregnant and what impact your stress can cause to your baby who is in the womb. So, we should know some relaxation techniques. So, let's start with our relaxation techniques. So, first and foremost, the very important technique in any situation when you're very anxious, you are very much stressed, is deep breathing. It is the best coping strategy when you're anxious or you're stressed out. So let's start with our deep breathing technique. So since we are talking about pregnant ladies, so I'll talk about the position and everything, keeping in mind a pregnant lady, right? So if you're pregnant, then you can sit in position, sit on a floor, uh, placing a mat. It's okay. You can sit if you can sit cross-leg position. But if those who cannot sit, they can sit comfortably on a chair. Please always remember to support your back when you're sitting on a chair. You can use one or two pillows to make yourself relax. Your back should not be straining, and your whole body should be relaxed on a chair when you're sitting. And if you are sitting on a floor on a mat, if you're pregnant, especially if you're in last 3 months, take a small cushion, a thin cushion, keep it under your bum so that your thighs and your legs are not in very same level. You will be able to sit properly. So if you're sitting on a floor cross-leg position, please try, those who are pregnant, keep a small cushion under your bums so that you can sit comfortably, right? So now once you are comfortably sitting, I want you all to relax back on your chairs, or if you're sitting, you can sit and close your eyes. Now again, a pregnant lady, you can place both your hands on your abdomen. You can feel your abdomen, or you can place one hand on abdomen and one hand on your chest. So you can sit like this so that you can feel the baby, the movements of the baby if you are in last trimester, if your baby has started moving. Otherwise, also your baby will feel your touch. So those who are pregnant, they can put their hands on their belly, both hands on bellies or one hand on chest so that you can feel your movements of the chest and one hand on the belly. Right? If the position is clear, we'll move ahead. If you have already sat down comfortably, now you can close your eyes. Close your eyes, relax, and now start inhaling. Again, one point I'll tell before starting. Those who are in their last 3 months, because of the tummy which is coming out, they may not be able to take very deep breaths. So don't try to take very deep breaths, right? Take small breaths. How much long you can take, that is okay. Don't try to exert yourself too much, right? So now let's start with it. Close your eyes. Take a deep breath. Close your eyes. Now inhale. Inhale as long as you can. Inhale from your nose, right? And then slowly exhale from your mouth. Relax. Keep your muscles as loose as possible. You should be wearing loose clothes. Don't wear any tight clothes. Especially also during pregnancy, you should not be wearing tight clothes. Now again, inhale, inhale through your nose and exhale through your mouth. Now one more time, inhale through your nose and exhale through your mouth slowly. Now when you are inhaling and exhaling, try to feel your chest rising up and down. And when you are pregnant, try to feel your baby inside your womb. Try to feel that your baby is enjoying this deep breathing. Because, because of this deep breathing, you are becoming calm, and so is your baby. He is also becoming calm and he is relaxing in your womb. Right? So deep breathing again. Inhale through your nose and exhale through your mouth. This you can do. Actually, a pregnant lady should do every day, 5 minutes, 10 minutes, 15 minutes, multiple times a day, because there are various situations in which you are stressed. As it is, your body is not capable of doing the work which you used to do earlier. So it will just not only calm your mind, it will relax your whole body, right? So keep breathing in and keep breathing out. This is a simple breathing technique. Now, if you want to go a little more advanced, we can combine these breathings with uh, something imaginary, and we can convert it into like meditation. The pregnancy meditation and yoga is also very important, and nowadays people are uh, focusing very much on pregnancy yoga and meditation. I'll not be talking about yoga because yoga is the topic of yoga instructor, and you should, if you are pregnant, you should always ask your doctor if you are if you can do yoga, and then go to a yoga instructor, certified yoga instructor, and learn your exercises as per your trimester, right? So we'll be focusing on pregnancy meditation. Now, since you're already relaxed and you have taking deep breath, now how can we go into a meditation state from? Now, see, you can close your eyes and imagine that the air which you are inhaling in from your nose, try to feel the air, the coldness in the air. The air is going from your nostrils down your windpipe and into your lungs. And now your lungs are expanding like a balloon. Hold it for some time. Now your lungs are collapsing again, and the air is gushing out of your windpipe and from your mouth. Right? Now we will imagine it in a more positive way. The air which you are inhaling, just try to imagine that air is not just air, it's air filled with positive energy. You can visualize it like I visualize it as white light, white pearls, small, small pearls in that air, and I'm inhaling those white pearls or particles of white light from my nostrils. So that white light is going from my nose, my nostrils, from my windpipe into my lungs, and the lungs are inflated, and the whole thing is white now. It's dazzling white with that pearl beauty. Now this air is going into my whole body till the tip of my toes, tip of my fingers, and my whole body is white. My whole body is getting positive energy that I have inhaled from this air. And now the air is coming out, which I am exhaling. The whole negative energy which was inside me, I have exhaled out my mouth. Just try to visualize it, imagine it. Inhale the white positive energy, going deep down your lungs to all your body, tip of the till tip of the toes and tip of the fingers, and your whole body is white with the positive light. Your baby is white with the positive energy which you are inhaling. Be in that positive energy for some time. Now exhale. Now when you're exhaling from your mouth, the negative energy which was inside your body is coming out of your body and it's going into the environment. This is a type of deep breathing which can be connected with meditation, and you will be feeling more relaxed when you do such techniques. Always try, since you are pregnant, try not to stretch yourself too much. You can start for 5 minutes, 10 minutes, because you may not be able to sit for a longer time. But do this as many times as possible so that you will be relaxed during your pregnancy. And this can be done by others also, not only who are pregnant. This can be done in daily routine life also. So you will be feeling relaxed uh, in your daily life. So this was first technique, that was deep breathing technique, and we have combined it with meditation. Now coming to the next technique is relaxing with calming music. As you must be knowing, music is also known as soul healer. It heals your soul. Soft, relaxing music makes you feel relaxed, and your soul is also relaxed. Same thing happens with a pregnant woman when she's pregnant. The music not only it calms down the mother, but it also calms down the baby, and it affects it helps in the cognitive development of the baby. It helps in the auditory development of the baby also. The baby is listening to the music. Always try to prefer that if you are listening to a music and relaxing, you should be wearing headphones. But if you're not comfortable, you can just play your music in a calm room and you can just relax. So let's go for it. Again, you can sit on a chair, putting some cushions in your back, or you can lie down on sit on a reclining position in a couch or a recliner. Always support your back. Don't stretch yourself. Put your headphones on and sit back. Close your eyes. Now, before starting the music, take 2, 3 deep breaths so that you are relaxed before listening to the music. Try to wean off all the extra thoughts which are coming to your mind. For 5, 10 minutes, just try to relax. Relax for yourself, relax for your baby. So just uh, lie down on just recline on your couch with the help of your pillows. Stay in a comfortable position and first take 3 deep breaths. Inhale through your nose, exhale through your mouth. Let's start. Inhale slowly, then exhale. One more time. Inhale from your nose slowly. Now exhale. Again, one more last time. Inhale from your nose and exhale. Right? And now I am putting on some music. Sit back, relax, close your eyes, and just enjoy the music.
You, you lied. You lied to yourself, saying that this year I'm gonna change.
Sorry about it. There was an ad. So now coming to the effects of music on the baby in the womb. So what are the wonderful effects that that music can do to the baby who is in the womb? So it improves the reflexes of the unborn baby. It improves the auditory senses of the baby. Then it also acts as a soothing lullaby after birth. If you are listening to the music, same music can be used to make your baby sleep after birth because the baby already uh, has baby is familiar with the music, right? And it helps in shaping the overall personality of the baby, right? So now coming to a little more advanced technique, which is progressive muscle relaxation. So again, in this, we will be relaxing each category of our muscles slowly, one by one, and you will feel that tension going away from your body. This not only helps in physically relaxing your body after a long day of work, but also helps you in mentally calming your mind off. So coming to the progressive muscle relaxation technique, again, position. If you should be either lying down flat on a bed, but since a pregnant lady in a last trimester may not be able to lie down flat on a bed, so you may use a recliner or a comfortable chair. Just sit comfortably on a chair. Always try to support your back with two pillows. It's very important for a pregnant lady because she is carrying a baby, and the if baby's weight puts pressure on the backbone, and if she'll not sit properly, she'll start having back. It's very important to sit properly. Your back should be straight. Your curve of the back should be supported. So take two, three pillows as much you want and sit in a comfortable position on a chair. Completely relaxed. Keep your hands free. Don't wear any tight clothing. Everything loose and comfortable. And those who are not pregnant, they are just learning for teaching purpose. They can always lie down on a couch comfortably. Now, when you have sat down comfortably or lied down comfortably, close your eyes and always we start with deep breathing to relax ourselves first. So again, three deep breaths with me, right? Inhale through your nose, exhale through your mouth, right? So let's start. Inhale and exhale. Inhale and exhale. One last time. Inhale and exhale. Now, once when you are relaxed completely, focus on the muscle or part of the body which I am telling you. What you have to do is tighten or squeeze that muscle for 5 seconds, then release that tension in that muscle, and for another 10 seconds, just feel how that muscle has been relaxed. So, slowly, slowly, we'll see that your whole body is relaxed. So, we start with the feet and toes. So if you're sitting, you can point your feet downwards and you try to squeeze your toes, pointing them downwards, all the toes and your feet. Try to squeeze all the muscles as tight as possible for 5, right? If you have squeezed it, I'll count 5. 1, 2, 3, 4, 5. Now release the tension in your muscles and feel that your muscles, your toes, your feet has relaxed. Feel the relaxation in your feet and toes. Try to feel that relaxation and stay in that relaxed state for 5 more seconds. Your toes and your feet are relaxed. Stay in this relaxed state for 2 more seconds. Yes, now coming to the next one. Now your calf muscle, that is your muscles below your muscle. Try to squeeze or tighten your calf muscle for 5. Squeeze your calf muscles tight. Now we'll hold these muscles in tight position for 5 seconds. 1, 2, 4, 5. Now release the muscles. Feel the tension going away from the muscle. Feel that your lower legs are relaxed. Lower legs are relaxed. Okay, now stay in this relaxed state for 5 seconds. Feel your lower legs relaxed. And now work on your thighs. Sitting on here, try to squeeze or tighten your thigh muscles as tightly as possible. Squeeze them, right? And now stay in this state for 5 seconds. 1, 2, 3, 4, and now release the tension in the thighs. Feel the tension going away from your thighs and feel that your thigh muscles are relaxed. Stay in this relaxed position for next 5 seconds. Feel that your entire lower leg is relaxed and stay in this for 4 more seconds. 1, 2, 3, and 4. Now your lower legs are completely relaxed. Now coming on to the buttocks. Sitting on the chair, try to squeeze the muscles of the buttocks as tight as possible. Like you want to go for potty, but you don't have or somebody's and you're holding tight on the ball. You can try to squeeze your buttocks as tight as possible and hold it for 5 seconds. 1, 2, 3, 4, and 5. Release the tension. Feel the muscles of the buttocks relaxed. Feel that they are relaxed completely and the tension has gone away from your buttocks and all of your lower legs. Stay in this relaxed position for 5 more seconds. 1, 2, 3, 4, and 5. Right? Now work on your abdomen. Those who are pregnant may skip the abdomen part or don't squeeze your abdomen 2 times, right? So now squeeze the muscles of your abdomen as tight as possible and hold this for 5 seconds. 1, 2, 3, 4, and 5. Now release the muscles of your abdomen. Feel them relaxing. Feel the tension going away and be in this state for 5 seconds. The tension has gone away and your body is relaxed from your abdomen, from your buttocks to the entire lower limb. Be in this state for 2 seconds. 1 and 2. Now coming to your back and shoulder blades. Try to tighten the muscles of your back and shoulder blades as tight as possible and hold this position for 5 seconds. 1, 2, 3, 4, and 5. And now relax. Relax and feel the tension going away from your back muscles. Feel that your back is completely relaxed. Your aches and pains have gone away, and your body is completely relaxed. Feel that your body from your back, your abdomen, your buttocks, your lower limbs are completely relaxed and stress free, tension free. Your aches and pains have gone away, and you are feeling relaxed. Be in this position for 2 more seconds and then come to your shoulders. Now tighten your shoulders like this and be in this position for 5 seconds. 1, 2, 3, 4, 5. Relax the shoulders. Feel them relaxed. Feel the tension going away from your shoulders. Stay in this relaxed position for 2 more seconds. Feel your body, your back, your abdomen, your buttocks, your lower leg in a relaxed state. Now coming to your hands. Put your hands forward like this and squeeze your fingers tightly, as tight as possible, and hold it for 5 seconds. 1, 2, 3, 4, and 5. Now release them. Feel the tension going away from your fingers. Feel that your fingers have relaxed completely. There are no pain and loops. Your body is relaxing slowly and slowly, step by step. Your body is relaxed now. Be in this relaxed, peaceful state. 2 more seconds. Your fingers are relaxed, your shoulders are relaxed, your back is relaxed, your abdomen is relaxed, your buttocks is relaxed, and your entire neck is relaxed. Right? Now coming to again, keep your hands forward, hold it from your elbow and tightly try to pull it towards your shoulders as tight as possible so that your muscles tighten up, your biceps, triceps tighten up. Do it like this and keep it for 5 more seconds. 1, 2, 3, 4, and loosen the grip, relax the muscles, straighten your hands and feel the muscles of your hands relax completely. Your complete hand is relaxed now. All aches, pains are gone. Your shoulders, your back, buttocks, your entire leg is relaxed. You are in a relaxed, comfortable position, right? Now, coming to your neck and jaw. Tilt your neck backwards, or you can do it forward. Try to touch your chin on your chest and try to keep it in this position for 5 seconds. 1, 2, 3, 4. Lift your neck. Feel the tension away from your neck. Be in this position for 4 seconds. Feel the tension away from your neck, shoulder, back, and entire you are relaxed. Feel it as a wheel. Now, last is close your eyes as tight as possible. Hold it for 5 seconds. That's it. Close your eyes and hold it for 5 seconds. 1, 2, 3, 4, 5, 6. Open them. Feel the relaxation of your eyes. Feel that feel your entire body relax from head to toe. Each part of the body is relaxed. Be in this relaxed state for a few seconds. Stay in this state for a few seconds. I have relaxed. I totally relaxed. My breathing is staying for a few seconds. Want to be in the state for a few seconds slowly. His range of 100% also in the weather, but now your whole body is relaxed. This you can also try if you are having insomnia. If you are sleeping difficulties, lie down on the on your bed. Do this process of muscle relaxation slowly and slowly. And by the time you reach the top of your body, your whole body will relax and you will you will fall off to sleep very quickly. This is a very common techniques nowadays used to with patients with stress, anxiety, and right. So coming to next, these were two techniques for relaxation, and we will be going to the next thing, which is an activity. It may feel little childish, but actually it's not childish. I'll tell you what. So first of all, I want you all to have a pen, a rough paper, and a pen, right? And I'll give you 1 minute to write anything which is bothering you in 3, 4 lines on that piece of paper. Any thought which is bothering you too much today, maybe from a week or anything from your life, if you want to forget, you want not to remember, forgot anything, any thought, just write on a piece of paper and write. You have written it. You can do one thing. Either you can make an aeroplane like we make it during childhood. You will just make an aeroplane out of it and just flew it off. And imagine that with this aeroplane, your worries and your tension has gone up. This technique will not only help you to relax, but this creativity will help the child in the room to develop his brain, cognitive development of the brain. Again, activities like puzzle solving, like find the help the rabbit find the carrot, or any type of puzzle activity. If a mother during pregnancy is uh, solving puzzles, or if she's interested in art or dance or music, painting, if she is doing all these things, it helps in the development of the baby, right? And the last, it's very important that the partner should be involved with the mother during the pregnancy. Role of partner is very, very important. If partner is supportive, the lady stress level will decrease itself, and they both can work together to have a stress-free pregnancy and a healthy baby and a happy family. So this is a concept nowadays where we say that I am not pregnant, if the wife is not pregnant, we are pregnant. That is, the couple is pregnant. So the role of partner is very, very important. So that's all for today's presentation. Thank you. And just a few words about the upcoming events. We will be having a free webinar and the series of a webinar Expecting Mindfully Part 2. And this time the topic is depression during pregnancy and its management, which will be taken by Dr. Deepika Chandani Shah. Then we will have another upcoming workshop on psychotherapeutic techniques to manage stress during pregnancy. We'll tell you about the dates and information about it will be shared later on. And again, our Happy Pregnancy OPD is free of cost since we are getting good response and we want to help general crowd. We are again this month also we will be conducting it free of cost, 11 to 2 p.m. every Sunday, wherein mothers who are pregnant or couples who are pregnant and have some mental health issues can talk to us on online mode free of cost, and we are there to solve their problem. Thank you so much for being with us. I hope you have learned something from the workshop. Thank you. Thank you.